Hey everyone, welcome back. I'm really excited for a very special episode. We're going to be talking with Dr. Xiaojue, who's a psychiatrist. She's an assistant clinical professor at NYU, and she is on the forefront of psychedelic research and understanding how these new compounds really revolutionizing psychiatry. So Xiaojue, welcome.
Oh, thanks, Drew. It's my pleasure to be here. It's good to talk to you.
Yeah, well, it's been wonderful talking with you, Xiaojue. You've just really brought so much to our group. As Xiaojue is a clinician with us, and just really helped me think more about what these compounds mean, how they're changing the field. I think a lot of us who are maybe I don't know, weren't trained when these were cool, have a lot of questions, and so I thought we should just talk today a little bit about the psychedelics that are coming into psychiatry, what they are, a little bit about how they work, just to orient everyone. So first, you were just at the big psychedelic conference in New York City, Horizons. And can you tell us a little bit about the feeling of being there and the buzz, what people were talking about?
Yeah, sure. Thank you. I know psychedelics is sort of like maybe such a buzzword these days. It's sort of a field that's mushrooming, just even in the last few years. So yeah, Horizons is sort of one of the longest running psychedelic conferences. And I think this year was its 14th year. And usually a lot of these conferences focus on like the scientific, like clinical impacts of psychedelics, like the research, which is awesome and which is what I'm involved in. And this time they also brought in a lot of speakers talking about all the other dimensions of psychedelics, just because so much is going on now, including the legal stuff, like legalization, like when are they becoming legal? What does that mean? What's the process? And also sort of like the economic financial impact of it. Because, I think just in the last year, a lot of money has been pouring into this industry. So what is that going to look like? And of course, also just sort of the cultural indigenous lineage of these medicines, and sort of not losing sight of that as it's kind of growing. Yeah, so it was really exciting to just be in the room with all these really interesting, smart people. Yeah.
I got to tune in a little bit to the streaming live version of it. And there was such a feeling of people who'd really been grinding away at this research and looking at a variety of these molecules and how they can help our patients. And so I wanted to talk about, for the two of us as psychiatrists, sort of what the main molecules are that are being looked at right now, especially for people watching who are struggling with, it sounds like mostly depression and PTSD is where I've seen research, but I guess I wanted to start though, before we get to the molecules, just about you and some of the research that you're doing, because a lot of people talk about psychedelics and one of I think our efforts is to really get the information out there so people can think about the benefits and the excitement and all the buzz, which is super cool, but also what some of the implications and challenges and even risks can be for these compounds. But first, can you tell us a little bit about your work and your research?
Sure. Thanks, Drew. Yeah, so part-time, I work with Drew Ramsey in our practice. And the rest of the time, I'm a co-investigator on a USONA-sponsored clinical trial, which is a phase 2 trial researching the use of psilocybin in major depressive disorder. So yeah, with Dr. Steve Ross at NYU.
I remember Steve Ross was a few years ahead of me in residency at Columbia, and it was just, always one of those super smart, super cool, interesting physicians, and has really been one of the people I think, involved with sort of maps and thinking about, or at least having a kind of, I remember a long time ago, a decade ago, had a group talking about these compounds and their implications. So really has been, at the forefront. So interesting to get to be with him and see him as a mentor. But Xiaojue, can you tell us a little? So psilocybin, for everybody, that's we call them magic mushrooms, but it's I guess psilocine is the compound that you're giving. And what are you investigating? What happens to somebody with depression when they take a compound like psilocybin?
Really good question. And just going back to basic, psilocybin, is sort of like the psychoactive component of magic mushrooms. And so that's sort of like the chemical that makes people trip, have potentially hallucinations and all of those psychedelic experiences. And actually, the word psychedelic kind of means mind manifest. So it really means that these compounds can potentially sort of expand your consciousness, if you will, and kind of bring aspects of your psyche to you that maybe you don't have access to on a daily basis. And, we're all kind of still working on theories of exactly how psychedelics work. That's sort of like a really general overview. And so in the research, basically, it's a double-blind, like placebo-controlled trial, which just means that half the people get psilocybin, which is sort of the synthetic version. So it's just pure psilocybin, the chemical. We're not giving them like actual dried mushrooms because it's just really hard to control exactly how much you're giving someone.
But it's the same molecule. So somewhere in the lab, they're taking the molecular formula of psilocybin, which it looks very, I've got it here on my wall. Hang on, Xiaojue. Just pull it out since we're talking about it. Got some visual aids. So I think that this is a psilocybin, and what's interesting to me about psilocybin, and I think just fascinating, is that this is serotonin, and if you look, those really are so related, just in terms of molecular structure. And so anyway, Xiaojue and her colleague Steve Ross at NYU were giving this molecule psilocybin, and so what happens? I mean, can you tell us a little bit? You're in a research setting and someone's sitting there. Can you take us into that room with you a little bit?
Sure. I mean, it's similar to a lot of how psychedelic research is conducted. So basically, you have to screen participants just to see if they're eligible for the research. And, every research study has different rules about who's eligible, who's not. That's sort of set in advance. And then, if somebody makes it all the way through to eligibility, we have a dosing day. So, the effects of magic mushrooms and psilocybin usually kind of take maybe 5 to 6 hours. And during that time, we have 2 therapists sit with them and kind of just hold space and kind of do psychedelic assisted psychotherapy, which we can also talk about, like, what is that later as well. And then, that we have a few integration sessions just to kind of help them integrate their experiences and to see how that could translate into maybe changes in their depression. And because the theory is that, psychedelics are uniquely sensitive to what people in the field call set and setting. And so what that just really means is sort of like your internal environment or context, sort of like your mindset, your emotions, your thoughts, your own psychological history. And then setting is sort of like the external context. So like the environment, like lying on a couch with eye shades on and listening to music, but also the broader environment, like, your therapists, their relationship with you and sort of like the vibes of the place, and also the greater, social, like psychological, emotional context of the whole thing. And so, so they're sort of unique in that.
So not Burning Man.
Yeah, I mean, it could be a Burning Man. That could be a different.
That can be a therapeutic setting potentially, but I think it's interesting that so many people have had experiences with these compounds, and I think being a psychiatrist in New York, both of us have seen lots of patients who've taken a variety of things to alter their consciousness. And it's interesting to think about it in a therapeutic setting. I think especially for those of us who trained where thinking about the stuff, I wouldn't say was forbidden or verboten, but it wasn't, certainly hasn't been part of any kind of mainstream conversation. The, very beginning of that was probably ketamine. It's really fascinating to hear about, and we'll talk more in another video about some of the research and talk about psychedelic integration and what that is. But just and everyone, make sure and subscribe so you get these other videos, and so you really get, I think, some of the best information there. Xiaojue is really on the front line about psychedelic medicine and what's happening. But I want to talk about just quickly about the other compounds. So we have psilocybin, which are magic mushrooms. I guess there's also ketamine, both IV, nasal, and then in some therapies, IM and oral even, IM being intramuscular, and then also, I guess, MDMA. Can you tell us a little bit about these other compounds and how they're kind of, I don't know, playing in a role in our field and in treatment?
Yeah, sure. So ketamine is actually the only legal psychedelic right now. I know there's a lot of buzz about psychedelics and people are all asking like, well, where can I get them and stuff? And so right now, everything's still illegal, still,
I
Schedule
feel
1.
silly. Sometimes I've been talking to patients with resistant depression and they're like, oh, this is really interesting. What do I do? And there's that moment of, it's not, it'll be accessible maybe in Oregon, psilocybin next year, but we're far away. We don't have FDA approval. So anyway, sorry, keep
Yeah,
going. Yeah, it's the only,
yeah,
so ketamine is the only kind of
only legal
possible psychedelic. Okay.
right. And so it's a little different from the other ones in that it's sort of, it began to be used as an anesthetic. So it's a dissociative anesthetic, meaning that people use it in like surgeries to kind of knock you out and kind of disconnect you from the sensations of pain. And that's what it means with dissociation as well. So it really takes you sort of outside of your body. But people discovered that at lower doses than what they do use in surgeries for anesthesia, people can actually have this rapid antidepressive effect because, as you and I know, Drew, like in conventional psychiatry with antidepressants, it could take up to like 6 weeks for something to work. And so ketamine's unique in its really relatively rapid effects. That being said, in a lot of cases, sometimes those effects are not necessarily sustained over time. And I think there are different protocols people are working on now with, in terms of doses and adding therapy that can help sustain all of those benefits. But that's sort of what it is. Yeah.
That's ketamine, and yeah, I think for a lot of us, there was that notion that it's great. It was the first anti-suicidal agent in a certain way. That there's, as Xiaojue mentioned, if you come to the emergency room, you're really depressed and feeling suicidal, in that moment, to ease your pain or have you feel better, ketamine is really the only option. And it's been very interesting to see it grow in the field as an option for patients with resistant depression. And now also thinking, is it potentially an option or something like psilocybin an option for patients on almost an initial presentation as an alternative pathway to think about treatment for depression. Then after the sort of IV protocols, there's the Spravato, which is maybe that's not how you say it with an Italian accent, but an intranasal. And just Xiaojue, I don't have any ties to any of these companies. It's just what's available on the marketplace and sort of via physicians today. So that's ketamine. And then MDMA. Now, this is known to most people as the club drug ecstasy. And I guess we're going to talk a little bit about risks as well. But and ketamine is, I think, known to some people as, not just an anesthetic, but also Special K, a club drug. People talk about seeing folks at the club in the K-hole where people are in that dissociated state and if taking ketamine can be a drug of abuse. And it's certainly one of those drugs of abuse that I think surprises people, that there are folks who can become dependent on ketamine.
Totally.
Usually it's snorted. It was surprising to me as a physician to treat a few patients who are struggling with this. But by and large, because there's access through physicians and highly controlled, the idea is really to avoid those negative consequences and have people get better from their significant mental health concerns like severe depression. But anyway, let's talk about MDMA. So MDMA is, what role does that play right now in psychiatry? Also, I guess not a legal substance, but something that's close to getting FDA approved and fast tracked now for PTSD.
Yeah, exactly. Thanks for giving us the street dimension, Drew. It's important to keep that in mind. Yeah, so right, MDMA is currently being studied in phase 3 trials, which is sort of like, I think, the last phase before a drug can become like legal. So it's being tested in large groups of people now for PTSD. And so they're sort of on the road to legalization and FDA approval. And that may come online, maybe even as close as the next 1 or 2 years or something. I mean, we don't know exactly. So that's what's really exciting in the field right now, and what a lot of people are kind of preparing for, that this could potentially be a really important treatment for PTSD. Yeah.
So I think the MDMA story for the treatment of PTSD is such an interesting one, and in some ways sad one when you think about the number of veterans, particularly that we've lost to PTSD, suicide really being the major killer of our armed forces. And the idea that there's been this molecule that it's hard for us to change our bias. Maybe this isn't a drug of abuse. Maybe this isn't a club drug. And also particularly something like MDMA. I was just watching an interview with David Nutt, who's a UK specialist on harm reduction, is a fellow psychiatrist, and he was talking about really the risk from MDMA was people getting dehydrated and overheated in clubs. And
Mhm.
if you look at a lot of the drugs that have been highly regulated, like LSD, the actual risk of those is, not that we should ignore that, but it's really low compared to the potential benefit, especially in a controlled setting. That we're thinking about risk. If you think about a risk where everybody's getting super high and doing
Right.
whatever, that's different than a controlled setting where these medicines are being used for an experience. And so it sounds like potentially the next sort of legal way for individuals who are struggling with PTSD to access a medicine like this would be potentially MDMA if it gets FDA approved. Um, are there sort of, for people right now struggling with depression, it sounds like ketamine is the only kind of psychedelic option. But why don't we talk more soon about psychedelic integration and how that works? Because I've found that some people have had psychedelic experiences and they want to work with them. Other people want to hear more about this work and kind of understand what it might be as they're considering it as an option. Well, Xiaojue, thank you so much. It's been great speaking with you about the landscape of psychedelic medicine. We talked about some of your research on psilocybin. I can't wait to see more of that published when you guys complete your trial at NYU, and also about some of the other agents that are out there, ketamine and MDMA. Is there a final message you have for anybody in terms of people thinking about this and how it fits into their sense of depression and
Sure.
other mental health disorders?
Yeah. I would just say that psychedelics are a very powerful tool for transformation. But just like any tools of power, it really depends on how you use it. And so I wouldn't think of them as sort of like a panacea or like a cure all for everything, because I know they've gotten a lot of hype and positive press, and I think a lot of it is very deserved. And we also just want to keep in mind that, you just, uh, the way it's used is really affects how the impact will be as well, and we'll talk more about that in future videos about integration and stuff like that. And I would also say that psychedelics exist within a broader context. They kind of came from a lot of indigenous traditions. We're introducing them into a medical Western system right now. But like medical use is not necessarily the only type of use that they've had. They were also used as spiritual sacraments in the past, and people like to use them recreationally. And we can talk about all of those implications too as well. But it's a big field, but an exciting one. And thanks so much for giving me some time to talk about it with you
Well,
today.
Shadri, thank you so much for talking with us about it. I just really have enjoyed so much our conversation over the last few years around how this is changing our field, and just your expertise and your really wonderful view of it all. So everyone, make sure and subscribe so you get the rest of our conversations as we're talking about how mental health and psychiatry are changing. And if you want to talk more about psychedelic experiences, or if that's been part of your experience and you need to process it in some way, Xiaojue, who is a wonderful psychiatrist, real expert in this field, and a wonderful member of our group. So please check out her services on our website, drewramseymd.com, and you'll see our clinical services. Everybody, take care, make sure and subscribe. And most of all, as we say at every video, please do something today. Take care of your mental health. Xiaojue, so much. We'll see everyone soon.